far. Shortages, negative attitudes, and lack of resources are just some of the key factors hindering this process. But why are vaccines so important, more so for COVID-19? On this episode of Health Watch, we question and answer this critical point. My name is Sada Hassan. Every minute that passes by, we are constantly exposed to many viruses, bacteria, and microbes. As we cross by each other along the streets, touch surfaces, and even stand aside to catch up on conversations, bacteria are everywhere. Our bodies work in magical ways. When we are exposed to infections, the immunity system triggers a series of responses to neutralize the microbes and limit their harmful effects. Centuries ago in 1976, the father of vaccination, Edward Jenner, inoculated a 13-year-old boy with vaccinia virus, demonstrating immunity to smallpox or chickenpox, as we commonly refer to it. Professor Rodney Adam, the head of Pathology and Infectious Disease Unit at Aga Khan University Hospital, says that vaccines have a historical importance.
Well, vaccines have been important for many, many years for a large number of infections. And in fact, it was my first time in Africa, back when I was in medical school, that I was seeing children dying from measles. And that's almost a thing of the past, despite how contagious measles is. But when I moved to COVID vaccination now, the COVID vaccine has more potential for saving lives than any other vaccine in history.
But the story of vaccines began farther back. It is documented in the history of vaccines that Africans and Chinese had solutions for smallpox even before Jenner's discovery. A story is told of how Buddhist monks drank snake venom to confer resistance to a bite. But how do vaccines work?
Vaccines work by causing the body to create an immune response that will prevent infection or prevent disease from a various number of viruses and bacteria that might affect the body.
With COVID-19 pandemic across the globe, there is a crisis in having enough vaccines for every nation and its citizens. Wealthy nations have been accused of being selfish, as some have more than enough to vaccinate their vulnerable populations, while in Africa some countries have none. Here in Kenya, about 1% of the adult population has been vaccinated. This is significantly low if the country is to achieve full immunity against the virus. At first, there was a lot of hesitancy that resulted to delay in administering vaccines. We caught up with some Kenyans to find out their level of understanding on who should get the COVID-19 vaccine.
Hakuna yule mtu afanya feko, lakini kwa sababu inasemekana hii watoto kwa wananchi hawapati hiyo vaccine, lakini sana sana hao watu wazee as from 50 and above, almost 45 and above, hao watu ndio wanafinyika sana juu ya baridi, na ndio immunity yao inaenda ikiwa chini. So hao watu washughulikiwe wakiwa kwanza, halafu sasa hiyo wengine naye kama tumalize wengine nao wanaweza nini.
Every person is eligible if it prevents. If it prevents people from being infected, it is good. And I also believe that before something comes to the public, the researcher, they must have gone through the test to confirm that that thing is not harmful to the community or to the society or to the people.
All Kenyans should be vaccinated because this is a deadly disease. We've seen what it has done to other developed nations, and Kenya being a middle economy country, we can't risk losing the entire generation. So if possible, let all Kenyans be vaccinated.
Would you take the vaccine given a chance?
Mimi mwenyewe already nishadungwa moja na ngoje nyingine mwezi wa 6. Ndio ni mwezi wa nini wa 9. Ndio nidungwe. Na wakati nidungwa nisikia watu wakisema wao iko na effect ati mara unaumwa na kichwa. Mimi hakuna kitu nilisikia. Sasa nini naongojea mwisho.
If it has been tested, I can take. If it doesn't have any infection, Yes, but the worry is, has it been tested? That's why we are saying that this thing about vaccine, it should not be given to everybody to handle. It's supposed to be with those people who are responsible for them to test, and then they bring to us.
Kama kuna good explanation yake mzuri naweza kubali, lakini vile naona wanaongea siwezi ka accept.
Kwa nini?
Kwa sababu sijui kama juu hatujaambiwa disadvantages yake ya hiyo vaccine na advantage yake. Advantage wanasema inazuia, but what is the disadvantage yake? Hiyo ndio kitu kingine hatujaambiwa. Tukiambiwa disadvantage, pia juu kila kitu iko na disadvantage na advantage.
Well, to be frank, I haven't been vaccinated, but I'm looking forward to getting vaccinated very soon. I think it's the ideal solution for everyone.
COVID-19 vaccines work in different ways. They are made up of a genetic sequence, a messenger RNA, that contains information which can produce a protein, coronavirus.
The overall final mechanism is very similar. The difference is how they get the spike protein to see the immune system. With the RNA viruses, the RNA goes into the cell and the cell produces the spike protein so that the immune response will happen. With the AstraZeneca vaccine, it's a little bit different. It's actually within a virus that doesn't replicate, and then that's how the spike protein is produced within the body. So they have different ways of getting the spike protein there, but ultimately it's the body's immune response against the spike protein.
The RNA technology is a game changer in how vaccines are manufactured. Research is currently underway using the same technology for different diseases. Scientists say it could lead to solutions to diseases such as tuberculosis, HIV, dengue, and malaria. Vaccines will take years to develop, but the script is now changing.
Why does it take so long normally for vaccines? And part of it's an issue of the resources and the number of people at risk for an infection. So if you have a rare infection, let's say rabies, we still have rabies deaths in Kenya, but very few people get it and few people die. So if you wanted to study something like that, you would have to recruit people for years to have enough cases. So with COVID, part of it was that there was a very large number of cases available. Some of these trials enrolled 40,000 people. That's an extremely high number in comparison to many of the other vaccine trials. Also, technology has come along, and multiple companies were working on it at the same time. So we had the chance for, Pfizer, Moderna, AstraZeneca, and all of those to come along with their vaccines.
Despite the shortage of vaccines in Africa, some countries have ended up distributing their share to other countries, while some have expired, leading to destroying of the life-saving vaccines. Countries that have destroyed COVID-19 vaccines include Malawi, South Sudan, Liberia, Mauritania, Gambia, Sierra Leone, Guinea, Comoros, and the DRC.
These vaccines were not necessarily wasted. I think these are the vaccines that arrived with some of very short expiry dates, which was very difficult to deploy immediately. And at the end of the day, they expired. So I think there is no country that has really tried to lose vaccine for the sake of things. I think we need to really pass this message very clearly that we are seeing an extraordinary effort that is being done by all the countries to deploy the vaccine. But despite that, as I said, we've had around 450,000 doses that have expired.
Professor Adams says that vaccines have contributed a lot in managing COVID-19 spread.
All of the vaccines out there are very effective, especially for preventing severe illness from COVID. So we want to stop people from dying from COVID. Vaccines will do that. Then the second thing is, if we can prevent infection, not just to prevent disease, but to prevent infection, it will actually decrease transmission in the community. And we know that the vaccines do it somewhat, even if they don't do it as well as they prevent severe disease.
Some countries have started easing up measures, with some relaxing rules like wearing of masks for the vaccinated population. However, the World Health Organization cautions such a move.
Even if you are vaccinated and fully vaccinated, we still recommend wearing a mask when you're in the presence of others, particularly when you're indoors, because we don't have the full picture yet on vaccine and infection and vaccine and transmission. We have great data in clinical trials as well as real-world settings on the reduction in severity and hospitalization and death, but we don't yet have the full picture on transmission. There's very good indication that the vaccine works against infection and transmission as well, but people can still be infected and they can transmit.
Pharmaceutical companies like Pfizer have been on the limelight recently over remarks of having booster shots. There is no conclusive evidence yet over the need of such.
I don't know what the future is going to hold for the pharmaceutical companies. One of the things in the future that we will all be watching is the need for booster shots. And there are a couple parts of that. One is how long the body's immunity lasts. And there are some reasons to believe it might last for a long time. But then the other thing is, what about the new variants? And we can only assume that more variants will come also. So how effective will these vaccines be against the new variants? Maybe it'll be like influenza, where every year we need a new vaccine for the new variants.
How safe is it to mix vaccines? Vaccination timelines that were earlier outlined by countries depending on India to get vaccines have been sidelined due to the upsurge that was witnessed. Countries like Thailand now report of mixing of vaccines to have majority of its people vaccinated.
So far what we know is that many places are studying that, and many people have done it just because one vaccine is not available and they get another one. And we haven't heard of any health problems related to that. The next question is, does it work well? Does it work as well? And the answer so far seems to be yes, maybe even better. Remember that most of the ones we're using now are the spike protein. So it's really two ways of giving the same antigen to the immune system to work on. So it might be better. It appears to be safe, and I think we'll see a lot more of that in the future.
A single shot or two. At the end of the day, we all just want to acquire immunity against the COVID-19 virus. All factors in place, the COVID-19 pandemic is likely to stay with us longer, and vaccines seems to be the only solution. As the old proverb says, better safe than sorry. Sada Hassan for Health Watch, KTN News.